big one, the game changer, the Childcare announcement.
Yeah.
And you have some of the numbers on that, I think, don't you?
Well, the commitment was to $2.2 billion over 3 years. If I remember correctly, though, it's not starting until 2020.
Right. So you could almost plan it that if you're having your baby like now, by the time the program starts, you'd be eligible, give or take. Right?
Give or take, yeah.
So
there was some interesting commentary on that by Adam Radwanski. Well, just that oftentimes childcare plans don't turn out to be the vote getters that people expect, because by the time they're implemented, they're no longer relevant to them, and that this, because of the lead time, gives them that opportunity to still potentially gain the voting benefit from it.
Still, all kidding aside, I think it's the first jurisdiction in Canada that offers universal childcare. I didn't see anything to suggest it's income tested. It seems like if you have a child that's between 2.5 years old and hasn't yet started what we used to call junior kindergarten at age 4.
Still is.
That, is that right?
Yeah.
That,
my son's in junior kindergarten.
I thought it's like, okay, right, all day kindergarten. All right, fine.
Yeah.
My kids are a little older. And some of the criticism that came out from, I think, more people who are inclined to be on the left side of the spectrum were saying, well, what if your child is 1 or 1.5? And I think the costing is based on 100,000 kids or something like that.
Something like that, yeah.
So we'll see when the time comes what happens if your child is the 100,001.
Well, especially since some of the funding commitment had to deal with as well the pay scale for some of the workers who are in those childcare facilities. So there's some of the funding that's in there may not be going toward actual covering parents' expenses.
Right. So between the healthcare and education and childcare announcements, clearly the government wanted to do 1 per day, draw maximum attention to it. All of these things were articulated in the budget today. And so unlike the old days where there was budget secrecy, maybe the odd strategic leak here or there, the Premier did all these announcements personally rather than dispatching her ministers to do it on her behalf. So she wanted attention drawn to them. She wanted people to know that they were happening. It's a bit of a spending spree that we haven't really, the likes of which we haven't seen before, because these are all big ticket items. You know, it started off with extending full coverage, no copay, no deductible to the seniors public drug plan. And when the health minister, Helena Jasic, was asked the question, she priced that out at $575 million, which seemed like a lot of money at the time. But with the announcements that have followed, it seems like it's rather small by comparison. So all of that got done. And look, the opposition parties, it's almost predictable. The PCs are focused on cost, deficit, writing checks that the government might not be able to cash. The NDP have focused in on, well, that's not really universal pharmacare because it's not for everybody, and for children that are less than 2.5 years old, it's not really covered. And our dental plan, which we'll talk about in a second, because that's one that they kept for today, the Liberals.
That is.